Good morning, everybody. This is Dr. Anthony Chang from AI Med, and we're very, very excited to have a very special guest, a fellow cardiologist, AI enthusiast in Dr. Francisco Lopez Jimenez, and we're very lucky to have him from the Mayo Clinic and to shed light on the heart and cardiac manifestations of COVID-19. Francisco, what are your thoughts about the cardiac issues with COVID-19, and in particular, there's a lot of discussion now about hydroxychloroquine and cardiac effects, so love to hear your thoughts on that.
Sure. Well, first of all, thank you for the invitation. It's really a pleasure for me to be here, and we share this enthusiasm for AI, machine learning, and how to trying to solve many problems that we still have to solve. The coronavirus seems to like the heart in some way. One of the most common manifestations in patients with proven infection is that they actually have cardiac symptoms. They have electrocardiographic abnormalities that call anything from some non-specific changes to even changes that look like a significant heart attack. And they actually have symptoms like chest pain, chest pressure. So many of them actually go to the ER thinking that they are having a heart attack when what they have is just an infection. So that has been noticed, and people who get very sick generally develop not only the pneumonitis, but also myocarditis, which might actually be the cause of death in many of the patients who ultimately die. There has been a lot of discussion about the use of hydroxychloroquine as a potential treatment for this, and the evidence has been spotty at best. There are some studies, small, all of them, suggesting that it might be good for patients, and other studies have shown basically no significant benefit. So what we have here is one of those unique situations in the history of humankind where we have a huge need for something that works, and the scientific evidence is very, very limited. So we have to balance, do you remain purist and don't even try, or you just try given the limited level of evidence. What is very relevant for clinicians to know is that those medications, including chloroquine and also the hydroxychloroquine, is that those medications can actually kill. They oftentimes cause QT prolongation, and in some patients who are susceptible, this might actually lead to ventricular tachycardia and death. So that raises the need for ways for us to identify those at risk to develop these malignant arrhythmias, because if they are not at risk, I think it's fair to say, well, let's just give it a try and try the medication. It doesn't hurt. It doesn't hurt if the patient is not susceptible for sudden death. And that's where we believe that there is potential for that. And actually, we have been testing this over the last few weeks in how to use mobile technology to monitor the QT and using AI to do that in an automatic way, because as you know, as a cardiologist, even with the tracing in front of you, it takes some time to really measure the QT in a good, reliable way. But we cannot rely on patients measuring that at home, or having the patient having an electrocardiogram every day. So that's one of the solutions where I believe AI has a significant role here, particularly for people as we treat more patients with this medication. We need to be sure that we are providing the safest environment, screening out people who don't have it. Yeah.
Thank you, Francisco. In closing this brief webinar, I just had a question. Since you're expert in population health and cardiac patients, post 9/11, we saw a bump in the number of adults that had some cardiovascular event. Are you kind of bracing for that possibility? And this is sort of almost just as big a trauma and for a longer period potentially. So what do you expect to see from a population health perspective?
Excellent question, because it can go actually both ways, and I will tell you why. In one side, there are very good chances that we will see a significant spike in cardiovascular events, I mean, especially sudden death and acute myocardial infarction, because of the extremely high level of stress everybody is going through. And the stress goes from facing an enemy that you don't actually see, the fear to get infected, the fear to die, the fear to have a loved one being affected by this. And this extends not only to your family in your home, it extends to every single relative you have in the world. So because this is affecting the whole world. The fact that there is no single place on earth that is considered safe adds something more, because this is probably the only time in the history of humankind in the last 100 years that there is a problem that affects everything, and that adds stress. So the stress might increase this. The second thing is that as hospitals move to increase capacity and limiting care that is not urgent care, that by itself might actually increase the number of people who were having symptoms and were not treated. So it's a collateral damage of the things that we have to do to be prepared for COVID. And the third thing is that patients might actually be afraid to go to the hospital, and there are some anecdotal evidence that people were dying at home with an arrhythmia just because they were afraid to go to the hospital when they have the first symptoms. So even acute medical cardiac emergencies may not be being treated just because patients are afraid going to the hospital. Now, all those things will weigh very heavily on the possible spike of cardiovascular events during these days. However, playing the devil's advocate, we need to recognize that things are actually different in many ways. People are not facing the stress of the traffic rush every morning, right? We have far less pollution, and we know that pollution is actually a trigger of myocardial infarction. So, whether or not that's going to be significant enough, I don't know. I still believe that all the negative things around the pandemic, including the losses of jobs and financial insecurity, is going to just mount to the number of people dying. Yeah, unfortunately.
Yeah, we'll see. Well, Francisco, it was just a delight to talk to you, and we're so happy to have you on the faculty for AI Med Cardiology next month. So we look forward to interacting with you again. Thank you very much, Francisco.
Thank you for the invitation, Anthony. Thank you, Alexis.